Welcome to HairMD. We will discuss about hair loss in males. There are multiple causes for hair loss in males. In males, the hair loss mainly it is due to androgen and genetics. Androgenetic it is called. It depends upon the hormone and genetic predisposition to lose hair in a typical pattern in typical area or typical zone. It is called as androgenetic or male pattern baldness. This pattern is typical, area is typical, that's why it is called as male pattern baldness or androgenetic. There are two different parts in this. One is genetic predisposition. That means whenever in family anybody is having baldness, that means father, grandfather, uncle, brother, or from maternal side, maternal uncle or grandfather, maternal side grandfather, or maternal uncle or any other maternal brother, if they are suffering from baldness, then same gene is carried out in that person, leading to genetic predisposition to the hormonal dependent, that is androgen dependent, that is testosterone hormone, male hormone, that dependent baldness. What happens in everybody's body? There is a male androgen hormone, it is called as testosterone. This testosterone is converted into dihydrotestosterone or it is called as DHT. The person who is having androgenetic alopecia or male pattern baldness, in those patients, this area, total top of scalp, this area's hair, they are having one receptor which is called as DHT receptor, and in this receptor, this DHT gets attached with that hair and it causes premature shortening of anagen phase or growing phase of that hair, and then slowly hair's anagen phase stops, then hair's growth stops, and then hair enters into telogen and it is lost. With the help of androgen, these hormone DHT, these hairs do not grow continuously. Prematurely, their anagen phase is reduced. Those hairs, they become shortened, they become thinned out, and slowly they are shed off. And this shade of hair, they do not come back, and that area become bald. So this is androgenetic alopecia or male pattern baldness, and this male pattern baldness is the main cause of hair loss in males. Second important cause in case of males is it is telogen effluvium. Whenever that person is under stress of anything, any major illness or official stress of work, mental, physical stress, then that person may lose its hair. But this is temporary. These hairs can be grown back. Another important cause is nutritional deficiency. Whenever there is no proper nutrition or nowadays severe dieting or various types of strenuous exercise, and they if they do not take proper balanced diet, then that may be the one of the important cause of hair loss in cases of male. So diet is again, nutritional deficiency is again. Third important cause is hormonal dependent, especially thyroid, hypothyroid, and other hormonal disorders may lead to hair loss in cases of male. various scalp infections, then skin diseases, various, that means scarring type of alopecia. These are also one of the causes of hair loss in male. We will see the causes which can be treated properly and which can prevent further loss. For that, we have to treat it. Then, what are the various methods by which we can treat hair loss in male? We will see how we can treat the basic cause of this disease. See, when there is androgenetic alopecia, genes and hormone we are not going to treat. Then what is going to treat? We are going to prevent the action of DHT on that sensitive hair. So this action is blocked by only finasteride, that is drug which is FDA approved. This drug prevents conversion of testosterone to dihydrotestosterone, and then this action of dihydrotestosterone on uh, hair which are present on scalp is prevented, and then thinning and shortening of hair is prevented, and we can treat that pattern baldness. Another topical medicine which is used in pattern baldness is minoxidil. This is age-old medicine for last 25 to 30 years. This medicine is working. It works with increasing the vascularity and vasodilatation, and hair loss is prevented. So FDA approved two main treatment modalities. One is oral finasteride and another is minoxidil, topical minoxidil. This is the mainstay of treatment for any type of baldness, mainly which is affecting males, and pattern baldness also. Along with this, we are supporting these hairs. We are giving medicines in the form of various vitamins, minerals, ions, essential amino acids, protein supplements, and various supplements to the patient so as to support the damaging hair or losing hair. These supportive vitamins are also major part of the treatment. Then what other treatment modalities we are having for this hair loss? Especially in HairMD, we are having so many treatment modalities which are used worldwide in advanced countries and Western countries also, where these are the typical use. Low level laser light, LLLT, which is now approved by US FDA. It is 630 to 670 nanometer cold laser light. It is also available with HairMD. With these lights, those hairs which are becoming thinned out, they can be made thick or they can be grown with the help of low level laser light. Another important thing which is tried worldwide and widely used in majority of country is mesotherapy, where with the mesogun, with the meso apparatus, various growth factors, external growth factors, they are given into the scalp, and these external growth factors and biomimicking peptides, they are given with the help of mesogun, which try to stimulate the weakened hair and they make it thick. Again, micro injuries play important role in mesotherapy. Derma roller, it is again one of the important therapy which is evidence based and which is nowadays tried, which again works through micro injuries, and with that these thinned out hair they become thick. Anagen phase is increased. Nowadays, the important fourth most important thing which is coming out is PRP, platelet-rich plasma. Patient's own blood is taken out, and then platelets are separated, and these separated platelets, they are activated, and then they are re-injected into the scalp from where those hairs are lost. So this PRP is also coming up, and all these treatment modalities are available with HairMD, and it's giving very good results. And nowadays, yes, prevention of further loss, or making hair thick, or making thin hair thick along with the increasing length of hair, and keeping hair in growing phase is possible, and all treatment modalities are available with hair MD. A newer technology nowadays coming is erbium glass laser, 1540 erbium glass laser. Latest in last few years, scientists are trying, and they are getting encouraging results with the 1540 erbium glass laser. This is also available with HairMD, and we are also getting encouraging results with the help of erbium glass laser. So, low level laser light, erbium glass laser, PRP, mesotherapy, derma roller, all type of medical line of treatment, topical line of treatment, every type of treatment is available at HairMD to prevent further loss, or to bring back whatever hair are lost. So, for male hair loss in male, we are having every type of treatment modalities with us, which is medically and worldwide it is recognized. And even where medical line of treatment fails, we are having hair transplant also. So for hair loss, yes, hair remedy is the answer, where you can get all type of treatment, starting from medical to surgical, starting from minoxidil, finasteride, and all type of treatment modalities, to the FUE hair transplant, which is natural looking hair transplant. Thank you. If you got still any question, please write below, where we have given space to write your question. Surely we will give you answer. We will try to satisfy your query. Thank you. Thank you very much.